Good morning. I'm Tom Darrow from CBIA, and I'd like to welcome you to our 2013 Medicare Advantage Group Awareness Training Webinar for brokers. I'd like to thank ConnectiCare for sponsoring today's event, and also a big thanks to our presenters, Tony Gudeshi, who's VP of Medicare Programs at ConnectiCare, and Matt Gallagher, Director of Medicare Sales at ConnectiCare. This morning's webinar, which should last about 2 hours, is both mandatory for anyone who plans on selling ConnectiCare's Medicare Advantage plan and a CMS requirement. And we do have close to 150 agents registered this morning. At any point during the webinar, feel free to submit questions by typing them in the Q&A box in the lower right of your screen. And throughout the session, I will pitch them to both Matt and Tony. Also, all registrants will be emailed a link in the next couple of days to a recording of the webinar. And without further ado, I'd like to turn it over to both Tony and Matt. Tony?
Thank you, Tom, and thank you, everyone, for joining us today. As Tom mentioned, my name is Tony Tedeschi, and I'm the Vice President of Medicare Program here at ConnectiCare. With me is Matt Gallagher, our Director of Medicare Sales. Matt will be conducting the bulk of today's training. Also with us, to make sure Matt and I don't mess things up too much, is Teresa Benoit, our Director of Medicare Product. She'll be here to help address questions as they may arise. First off, I want to say that we are very excited with the product offering we built in partnership with CBIA. We've been working collaboratively and thoughtfully for over a year now to craft an affordable option for our Medicare-eligible members. This option provides benefits not found in the original Medicare or through supplemental plans, and brings you and your clients the stellar customer service for which ConnectiCare has become known. I want to acknowledge and thank my team as well as the folks at CBIA for the hard work and diligence required to pull this off. Here on slide 4, you'll see a high-level snapshot of the plan offering we've crafted. Matt will be covering all of this in much more detail throughout the presentation, but I wanted to create a frame of reference for you as we go through this presentation. First off, this is a point-of-service plan with benefits and cost shares that are the same whether the member goes in or out of network. Typically, you would see differences in cost shares when seeking care out of network. But because we know there are retirees that live out of state, we structured the plan design such that benefits and cost shares are the same both in and out of network. That means members will have access not only to our comprehensive contracted network of providers, but they'll also have access to any Medicare-approved provider across the country. You see here that this plan design is available to Medicare-eligible members, both retired and working aged. The premium of $339.93 should be very attractive to those members who will be paying close to $600 a month in 2013 in their current options. I've already discussed the national access to providers, so I won't repeat that here. Your commissions as brokers will be 3% of the full premium cost, and the pharmacy benefit is included in this product and premium. We've built an open formulary model for CBIA and have removed the donut hole. So from a member's perspective, the co-pays will continue on until they hit the catastrophic levels set by CMS. At that point, coverage actually gets better. Again, Matt will go into this in much more detail. So that's a high-level snapshot I wanted to convey. Thank you for attending today, and I hope that when we're through, you'll see this is a great option for your clients. At this time, I'd like to turn it over to Matt, who will take you through in much more detail the plan we built with CBIA and the requirements to compliantly sell it. Matt?
Thank you very much, Tony, and thank you for everyone joining us this morning. My name is Matt Gallagher, and as Tony alluded to, I'm the Director of Medicare Sales here at ConnectiCare. On the next slide, slide 5, you'll see the agenda for today's presentation. I'm going to cover several topics with you, some rather quickly, some in a little more detail. You will see from the agenda, we're going to do a high-level overview of Medicare. We're going to talk a little bit about what's going on in the Connecticut market regarding Medicare. We'll talk a little bit about Medicare Advantage plans, which are also known as Part C. We'll go through Medicare Part D. We'll look at some marketing guidelines that apply to the Medicare group product and market segment. Then we'll go into the specifics of the CBIA Medicare Advantage group plan that's being offered for 2013. We'll also talk a little bit about low-income subsidy, which comes into play with the Part D prescription drug plan that we're making available. We'll go through some of the enrollment processes for the CBIA program. as well as member services contacts for when members are once in our program who they need to contact with any questions, and then some important reminders that we want to leave you with today. So with that said, we'll jump into a quick overview of Medicare, which I'm sure many of you are familiar with, so bear with me if I'm repetitive in some of the information that you may already know. With the Medicare program, there are basically several different Medicare options available to beneficiaries that are eligible for Medicare. Some are government-run, some are run by private insurance companies like ConnectiCare that are approved by Medicare to offer these programs. You'll see here the traditional Medicare Part A, which covers hospital, Medicare Part B, which covers medical, physician, outpatient type services. Then there's Medicare supplement plans, which are privately managed standard medical plans. They're standardized by the state that basically fill in the gaps of what original Medicare covers. As most of you know, original Medicare is a good basic program, but it still leaves you with quite a bit you pay for out of your own pocket. That's where the Medicare supplements come in, and they fill in those financial gaps, but they typically don't offer additional benefits beyond original Medicare. Then you get into Medicare Part C, which we're going to spend most of our time talking about today. Those are Medicare Advantage plans, also known as MA or MAPD plans. Acronyms that represent if it's an MA-only plan, that means there's no prescription drug coverage, or an MAPD plan, which includes medical and prescription drug coverage. Today, in the program that's being offered through CBIA is an MAPD plan, which Tony alluded to earlier includes both medical and prescription drug coverage. These are privately managed medical plans that offer those benefits that are as good as or richer than the original Medicare program. And then, of course, there's Medicare Part D, which is prescription drug coverage, also known as a PDP plan, or prescription drug program. These are privately managed prescription drug plans that cover many prescription drugs that are not covered under the original Medicare program. So, with that said, let's move into the Connecticut Medicare market, just to give you a flavor for what's happening in our particular state and the market that you'll be working in. In the state of Connecticut, from December of 2011 to October of 2012, the Medicare Advantage market has increased here in our state by just over 16,000 members. That's about a 14% increase in Medicare Advantage enrollment. For the 597 or so residents in the state of Connecticut that are eligible for Medicare, approximately 132,000 of them are currently enrolled in a Medicare Advantage plan. That's a 22% Medicare Advantage penetration rate. When Connecticut entered the market about 4 or 5 years ago with our Medicare Advantage, with that said, Connecticut currently has about 42,000, just shy of 43,000 members in the state of Connecticut, which represents about a 32% market share. So let's move on to the Medicare Advantage plans. And as you can see from that Medicare Advantage slide, what I'm trying to demonstrate there for folks is that a lot of Medicare beneficiaries are very interested in Medicare Advantage plans. And you're also going to start to see a lot of employer group plans who are interested in this low-cost alternative, especially with the economy as it continues, and they look for low-cost alternatives for their retirees. So let's spend a few minutes talking about Medicare Advantage plans, which are also known as Part C, and some of the rules that apply to these programs. Medicare Advantage plans. How do they work? So again, Medicare Advantage plans are different from original Medicare. They are not Medicare supplement plans. Some people use those terms interchangeably, but Medicare Advantage plans are very different. They're administered through private insurance companies like ConnectiCare, and not the Center for Medicare and Medicaid Services, also known as CMS if you're not familiar with that terminology. CMS still has oversight responsibilities. Basically, in essence, what happens is we have a contract with Medicare to offer these programs, and we get approved by Medicare to offer these plans. From the beneficiary's perspective, what the beneficiary in essence is doing is saying, hey, federal government, I'm going to put away my red, white, and blue Medicare card. They should keep it in a safe place in case they need it at some point in the future. And they're basically saying, I want my Medicare benefits to be administered through ConnectiCare. And there is a unique ConnectiCare ID card, which we'll talk about a little later in the presentation. They typically work in the following ways. Beneficiaries get all their Medicare-covered benefits through the Medicare Advantage plan, which in this case would be ConnectiCare. We do have prescription drug plans on this particular program, but in general terms, Medicare Advantage plans may or may not have prescription drug coverage, but this one does. Beneficiaries may have to see certain doctors or go to certain hospitals within a Medicare Advantage plan for covered services. However, we have a national provider network available for the CBIA-specific plan. And then benefits or cost shares may be different under a Medicare Advantage program than under traditional Medicare, or original Medicare.
Now, Matt, we got our first question here for you, and that is, I know Medicare doesn't cover certain classes of drugs, i.e. antipsychotics. Does ConnectiCare cover them?
On our particular formula, we do have an open formula, and I'm going to get to that specifically. In the past, there were certain drugs that Medicare didn't cover. However, in 2013, there are certain drugs that they are covering, like benzodiazepines and certain medications like that were in the past we haven't covered, nor has Medicare. But in 2013, we did change that to start including benzodiazepine prescriptions and things like that.
Great, and I wanted to remind our participants to simply type their questions in the Q&A block in the lower right. We've gotten a couple in the chat block, and sometimes we can't all see those, so put those in the Q&A block. Thanks a lot.
Thanks, Tom. Just a reminder to all of our participants, there is about 40 slides we want to get through this morning. I think I'm probably going to answer the majority of questions that you might have as I go through these particular slides. We will have time at the end for a Q&A session. So I would ask that you hold off questions until the end so we can get through the slides. We will periodically stop to answer questions as they come up. So back to the Medicare Advantage plans and the Part C overview. How do these plans work? Continued. Beneficiaries who join the Medicare Advantage plan must continue to pay the monthly Medicare Part B premium. In 2012, the standard amount is $99.90 for most people, but it can be up to $319.70 based on certain income levels. In the past, everybody paid the same Part B premium, but over the past few years, the federal government has changed that, and the Part B premium that individuals pay is based off of their income level and how they file their tax returns. No matter what type of Medicare Advantage or Medicare coverage you have, whether it's traditional Medicare and a supplement plan, or a Medicare Advantage plan, you have to continue to always pay that Medicare Part B premium. And that's the amount that gets taken straight out of people's Social Security checks and goes straight to the federal government. What happens with Medicare Advantage programs, and why we're able to offer these plans at much lower premiums than a supplement plan, for example, is through our contract, the federal government pays Medicare Advantage organizations, also known as MAOs, in this case ConnectiCare, a set amount each month to cover the services that we present under our program and that the member receives. The member may have to pay an additional premium for the MAO, in this case ConnectiCare, and be responsible for other cost share amounts, and we'll get into what those are in a few minutes. Additional Part C overview, are beneficiaries still part of Medicare if they join the Medicare Advantage plan? I get this question a lot. Do I lose my Medicare benefits? No, you do not. They are still part of the Medicare program. If you join a Medicare Advantage plan, you're not opting out of the Medicare system. What I mentioned before is, as a beneficiary, you're basically saying, I'm putting away my red, white, and blue card, and I'm not having the federal government administer my Medicare benefits. I'm having ConnectiCare do it instead. And in return for that, we get a reimbursement on a monthly basis for each one of those individuals that joins our program. And from the reimbursement perspective, it tends to be a little higher for somebody that's a higher utilizer of services, and we tend to get reimbursed at a lower amount for somebody who doesn't utilize as many benefits. So beneficiaries, as I mentioned, are still part of the Medicare program. They have all the rights and protections that original Medicare offers. They receive all Medicare-covered services through the Advantage plan. Part of our contract with the federal government is that we have to cover everything that Medicare Part A and Part B covers. But they may also receive additional benefits beyond original Medicare, and we'll get into what some of those are, like vision discount benefits, things along those lines. They also may receive prescription drug coverage through the Medicare Advantage plan, which in this case, through the CBIA program, they will. It's both medical and prescription drugs included in that premium amount that Tony talked about earlier. Member rights under a Medicare Advantage program. The member continues to have rights to file an appeal or a grievance to a fairly efficient and timely process to resolve differences with their health plan. This process includes the initial decision made by the plan, an internal review, and if needed, an independent external review, depending on the circumstances that are at play. Basically, an appeal is when somebody files something that they feel should have been covered and perhaps wasn't by the plan. A grievance is more of a complaint. It took too long to get an appointment with the doctor. I had to wait too long. Or when I spoke to customer service, perhaps the person wasn't cordial on the phone. That's more of a grievance versus an appeal. They can ask their plan to provide to pay for a service they think should be covered, provided or continued. And they also have the right to an expedited appeals process whenever they're receiving services in an acute care potential facility like skilled nursing facility. Eligibility and enrollment. So who can join the Medicare Advantage program? Beneficiaries are eligible to join the Medicare Advantage plan if they live in the plan service area, which is a national service area for the CBIA program. So basically, if a retiree lives anywhere in the U.S., they can still join our program. They have to be entitled to Medicare Part A, and they have to be enrolled in, and as I mentioned before, continue to pay for that Medicare Part B premium. And they cannot have end-stage renal disease. That's about the only medical condition or pre-existing condition where they wouldn't be allowed to join our program. They will not qualify if they have end-stage renal disease, which is permanent kidney disease requiring dialysis or a kidney transplant, except under certain limited circumstances. For example, if somebody were to join our program and then develop the ESRD, they would be covered under our program. But they can't typically enroll in our program if they currently have end-stage renal disease. Other than that, that's about the only pre-existing condition. Other than that, anybody is entitled to our program as long as they meet the eligibility requirements that we just discussed on slide 15. Okay, Medicare Part D. Medicare prescription drug coverage, also referred to as Part D, became effective, as some of you may know, back in January 1st of 2006. It's available to everyone who has Part A and or Part D. If a beneficiary joins a plan offering Medicare drug coverage, there may be a monthly premium. Medicare drug plans offer different benefit designs. Some plans offer more coverage and additional drugs for a higher monthly premium. The beneficiary will pay a share of the cost for prescriptions. Beneficiaries with limited income, however, may qualify for what's known as extra help in paying for their Medicare prescription drug coverage. They may get assistance in the portion of the premium that counts towards the pharmacy benefit. They may also have reduced co-pays in what they pay for their prescription drugs. The beneficiary that decides not to join a drug plan, however, a Part D plan, when they are first eligible, may be subject to a penalty if he or she opts to join later. This is what's known as the late enrollment penalty. And as many of you know, if you do not have creditable coverage, which is as good as or equal to the Medicare Part D standard prescription drug plan, and you haven't enrolled in a Part D plan, when you do enroll in a Part D plan, you may be subject to this late enrollment penalty. And we'll talk a little bit more about that later on. And this is something that you need to be familiar with, because a major difference between what's currently offered to CBIA retirees is that the RX plan that they have today is what we would refer to as a commercial RX plan versus the Part D plan that's offered through the ConnectiCare program. And we'll get into that prescription drug program and the cost shares that are affiliated with it in a moment. The initial enrollment penalty that I discussed previously, if the beneficiary chooses not to enroll in that Part D plan during the initial period when they're first eligible, they may be assessed that late enrollment penalty. And that's if they haven't had creditable coverage and they haven't had a break in that coverage for more than 62 days. If they were subject to this penalty, it's a 1% premium penalty that's assessed for each month that the beneficiary was not enrolled and did not have credible coverage. And the penalty typically will not exceed 10% in a given year. That premium penalty continues as long as the Medicare beneficiary is on a Medicare Part D plan. The penalty is on the premium only, and it does not affect the coverage that the beneficiary receives. Now, it's my understanding that the current 2012 plan design that is being offered through Anthem is a creditable plan. So this should not really come into play with very many retirees in the CBIA arena. So most likely they're not going to be subject to this late enrollment penalty, but I thought it was important to cover that so we understood what that was. Again, because the plan they're on today is creditable, there shouldn't be an issue as long as they don't have a break in coverage of more than 63 days. Okay, some of the marketing guidelines that are applied to the Medicare group program. And basically, CMS defines marketing as the steering or the attempting to steer potential enrollee towards a plan or a limited number of plans. In the employee group marketing arena, basically the marketing guidelines apply to the individual broker and the transaction that takes place between that broker and the employer. Brokers cannot claim to be a representative of the federal government or CMS. They cannot make false or misleading statements, claims, or promises about the plan that's being offered. They cannot offer any type of gifts that are of a nominal value, which is $15 or less annually. The broker may not market or sell in any type of healthcare settings or at educational events. And what that means is if you happen to be in a healthcare setting, you cannot talk about Medicare Advantage programs where healthcare services are being delivered. For example, in the waiting room of a doctor's office, or at a prescription drug counter of a pharmacy. These probably aren't going to come into play much in the group arena, but it is something that you need to be aware of. Brokers must be appointed according to state laws and licensed with ConnectiCare, again in accordance with state laws. Brokers must be trained annually, and that's what's taking place today, on the plans that they're going to sell, including the plan-specific details and the Medicare rules that apply to the specific products. So in order to make things easier for you, we want to conduct this webinar today to take care of that requirement from a training perspective, that you're knowledgeable of the specific CBIA plan that's being offered, as well as the Medicare rules that apply to that specific plan and the marketing of these types of plans. So, let's jump into the specifics of the CBIA Medicare Advantage Group plan that's being offered starting on January 1st, 2013. As Tony mentioned earlier, it is a point of service plan, also known as an MAPD plan, again, which means it has medical and prescription drug coverage included. It's available for all CBIA employer group retirees and working age employees in Connecticut and not actively at work are Medicare eligible, okay, meaning they have A and Part B, and they work for an employer that has less than 20 employees where Medicare would be primary. Not only would that individual be eligible for this program, but any retiree of CBIA groups would also be eligible as long as they have Medicare Part A and Part B. This plan is effective January 1st, 2013, so you can start selling this program today after we're done with the training, and you can enroll folks for January 1st, 2013. As Tony alluded to earlier as well, it's an open access plan, which means there are no referrals required. So if somebody wants to go see a specialist on our program, they don't need to get a referral from their primary care doctor. Prior authorization is required on certain services, and that's all highlighted in the benefit summary that will be available to you. It is an open formulary. It's an open Part D formulary. It's different from our ConnectiCare commercial as well as our individual Medicare products. So for those of you who sell other ConnectiCare commercial products or our individual Medicare program, this formulary is very different. It's an open formulary, so any Medicare Part D drug would be covered under this program. Some of the plan highlights: it's a comprehensive, low-cost alternative to what's being offered today at a monthly premium of $339.93. The maximum out-of-pocket is $3,400. This basically provides financial protection for the beneficiary. So no matter how bad the situation may be for that individual from a healthcare perspective in 2013, the most they're going to pull out of their own pocket for medical services would be $3,400. Now, what counts towards that $3,400 are any services covered by Medicare Part A and Part B that under our plan have any type of cost share. It does not include, and I repeat, does not include prescription drug costs or premium. Again, it's only those services that are covered under Medicare Part A and Part B. So, for example, if there's a copay on the primary care doctor, anytime they pay that copay, it counts towards the $3,400. If there's a specialist copay, anytime they pay the specialist copay, it counts towards the $3,400. We also cover a comprehensive annual physical. It's not covered by Original Medicare or supplemental plans. Original Medicare for years did not cover routine care for the most part. Then they offered a wellness exam, or a wellness where the doctor basically talks to the individual about their health and what's going on. Beyond that, our particular program actually covers a full-fledged, comprehensive annual physical every year. Again, it's very important for an individual to go and get their preventive type care services in an annual physical exam because it's much easier to treat a problem when it's first diagnosed before it becomes a major issue for that individual. We also have a vision discount program that offers discounts of 25 to 30% on frames, lenses, prescription contact lenses, and sunglasses when using participating optical providers. So these are some of those benefits that you get above and beyond regular Medicare or the supplement plan. We have worldwide emergency care, up to $50,000 annually. Basically what that means is we will cover an individual, no matter where they're traveling in the world, outside the U.S., up to $50,000. For those of you who are familiar with the Medicare program, Medicare will only cover individuals, as well as most supplement plans, for those services only provided in the U.S. or the U.S. territories. Not only do we do that, but we will cover worldwide emergency care. We also have our ConnectiCare Touchpoints program, which is access to health and wellness resources and services. We have case management programs for COPD, diabetes, heart disease, and cancer programs. We have treatment decision support. So when somebody needs a major treatment or major surgery, we have decision support folks that can help them navigate the system and figure out what the best course of action for them is, or the best course of treatment. And we also have important health reminders throughout the year, reminders on immunizations that people should be getting, flu vaccinations, those types of things, as well as medication reminders depending on how somebody's treatment or course of treatment is going. We're also the highest ranked Medicare Advantage plan in Connecticut for health plan quality. The maximum you can get is 5 stars, and currently, in 2013, Connecticut has a 4.5 or 4.5 star rating out of 5. We are the highest ranked plan in the state of Connecticut. From a network perspective, we have more than 27,000 fully credentialed healthcare providers. We have all hospitals in the state of Connecticut except for the Children's Medical Center, which really doesn't come into play much with Medicare beneficiaries. Other than that, we have every hospital in the state. We have a different network from our ConnectiCare commercial. So again, those of you who are familiar with our commercial products, the network, as well as the formula that I discussed earlier, are different than our commercial products. So it's important that you remember that. The POS plan does offer the flexibility to seek services from any Medicare approved provider in the United States and its territories. So individuals can seek treatment basically anywhere in the U.S. from any Medicare-approved provider. We also have participating providers outside Connecticut. We have several providers on our borderline states in New York and Massachusetts. We also have West River Hospital in Rhode Island, so people down in the eastern part of the state, southern part of the state, have access to West River Hospital as well, and they're considered an in-network hospital. We do have a national pharmacy network, including CBIA, Walgreens, Walmart, Rite Aid, all the major chains, basically. We also have our provider directory available online at www.ConnectiCare's.com, which will also be available to you through the CBIA website that most of you, I'm sure, are familiar with. That's the best place to look at providers because that gets updated on a daily basis. If you do happen to use our paper provider directory or a PDF version of that provider directory, which will be available to you, that is basically outdated once it goes to print. So the best resource for looking up providers is going directly to our website. It's very easy to locate doctors and look them up in our directory. And again, it's the most updated information because that gets updated on a daily basis. Okay, so let's take a look at an overview of the medical plan, and then we'll jump into the prescription drug program. As we mentioned before, it is a POS plan. So to make things very simple, we've designed this program so the in and out-of-network benefits are exactly the same for a beneficiary. You'll see at the very top, the monthly premium again is $339.93. The maximum out-of-pocket, which I spoke about earlier, is $3,400. The annual physical exam is a zero copay, so it's covered in full. Any visit to a primary care physician is a $15 copay. So anytime the individual pays that $15, it counts towards the $3,400. Specialist office visit is $30. Routine hearing, diagnostic radiology, therapeutic radiology, all covered at a zero copay with no cost to the beneficiary. If somebody were to need an ambulance in an emergency situation, that would be covered in full as well. We've already talked about the worldwide emergency care. Again, it's a $50,000 limit outside the United States. For outpatient surgery, if individuals go to a freestanding ambulatory surgical center, it would be a $200 copay. If they have services done at the hospital, it would be a $300 copay. And anytime they pay those copays, as mentioned previously, they count towards the maximum out-of-pocket of $3,400. Inpatient hospital, God forbid somebody needed to go to the hospital. For the first 7 days that they're in the hospital, an individual would pay $250 each day for the first 7 days. So if they remain in the hospital after day 7, that would be covered in full. And again, each $250 that the individual pays would count towards that $3,400. If somebody were needed to go to a skilled nursing facility, it's covered at a zero copay, so the individual would be covered in full. And unlike traditional Medicare and several supplement plans, we do not require that the individual have a 3-day hospital stay before they're admitted to a skilled nursing facility. If the skilled nursing facility is the right place to get care for that individual, they can go directly there for their care and start out with day 1. So let's move on. Again, this is just a high-level overview of the benefits. You will have access to the benefit summary on the CBIA website, and we'll talk about that a little later in the presentation. But again, we just wanted to give you a high-level overview of those benefits that most people ask about. From a prescription drug perspective, you'll see here on this slide, we have basically the option to get your prescriptions in a 30-day supply or a 90-day supply. At retail and mail order, it's a $10 copay for Tier 1 generics, a $40 copay for Tier 2, $80 copay for Tier 3, and $80 for any specialty drugs. Those are usually very expensive drugs. They tend to be injectables. It's not something that you routinely would get at a regular pharmacy. It's typically a specialty pharmacy that the provider or the individual has to order, and we usually have those delivered directly to the physician's office or to their home, because typically they need to be injected or self-administered. For the 90-day supply, you'll notice that through mail order, there is some cost savings for the individual. If they are taking maintenance prescription drugs, they should be advised to take advantage of our mail order program, where you can get a 90-day supply, but only pay 2 months' worth of copays and you'll see that highlighted in light blue. For Tier 1 drugs, it's $20 copay for a 90-day supply, $100 for Tier 2, $200 for Tier 3, and $200 for Tier 4. A beneficiary will continue to pay those copays until they hit the catastrophic drug limit, or a catastrophic amount of $4,750. That number gets calculated by what the member pays out of their own pocket. So if they just have a really bad year, or happen to be high prescription drug users, if they get to that $4,750 limit with the copays that are noted above, the individual then hits the catastrophic amount, and they're going to pay the greater of $2.65 or 5% for generic drugs, or $6.60 or 5% for all other drugs. So it kind of acts as almost an out-of-pocket maximum to the sense of financial protection, where if somebody has that type of prescription drug usage, once they get to that $4,750, they'll only be responsible for these reduced copays for the remainder of the year. And then that starts all over again each year. These benefits are on a calendar year basis. And again, with any questions specific to the medical or the prescription drug program, we'll certainly have time at the end of the presentation to go over any questions that folks have. So let's talk about low-income subsidy, because this is something that may come into play with folks that you don't currently experience with the Medicare, original Medicare, and the Anthem supplement plan. The low-income subsidy is basically individuals with limited income and resources may qualify for what's known as extra help from Medicare to cover all or part of their Part D plan premium and cost sharing. Beneficiaries may also qualify for help from the state to pay for their Medicare Part A, if any, or Part B premium, for Part A and Part B deductibles and cost sharing. So depending on the income level that some individuals have, they may qualify for various levels of extra help. There are basically 4 levels of extra help, and we won't get into the details of what those are today because those get determined by the Social Security Administration. But individuals may qualify for extra help. They're encouraged to apply through the Connecticut Department of Social Services or the Social Security Administration to determine their eligibility. It's typically not something that automatically happens. Individuals have to apply for it. To qualify for extra help, income may not exceed 150% of the federal poverty level, or FPL. And in 2012, and these numbers may change for 13, but this is the latest information I have, it's $16,755 for individuals and $22,695 for couples. If they qualify for the extra help, they'll be placed into one of those 4 levels of extra help for Part D costs. The beneficiary is notified by LIS of their LIS eligibility by the Social Security Administration. So there's not necessarily much you need to do as an agent or a broker. The Social Security Administration will notify individuals or the beneficiary if they're LIS eligible. Beneficiaries are then also notified by ConnectiCare in writing during the enrollment process. And what typically happens there is we will get notified by CMS, or the federal government, that somebody is LIS eligible. If they are, they will get a special rider mailed directly to them from us, which will outline what their prescription drug costs and if there's any reduced premium amount that they are entitled to. We also at ConnectiCare conduct it is an outsourced outreach program that we conduct to help individuals realize if they are eligible for this type of program. We will help them do the appropriate work to get enrolled into this program so they can take advantage of these benefits. Again, ConnectiCare will notify CBIA of all the LIS members once we're notified by CMS. CBIA will be responsible for billing the employer for the correct premium amount because these individuals who qualify may be eligible for a reduction in the overall premium. At the end of the day, what the important thing is between ConnectiCare and CBIA, and what you should just be knowledgeable of, is that the member, the individual beneficiary, must receive the subsidy if they pay for any portion of the premium. So the employer group can't benefit from that eligibility in the LIS program other than the individual has a reduced premium that they'd be responsible for. But any subsidy will need to be passed back to the beneficiary by the employer group. So we just want to make sure you're aware of that. Again, I don't expect the LIS issue to come into play a lot, especially with the working age individuals because they're currently working and their income level is probably above those thresholds. You may come across this once in a while with retirees depending on their financial situation. So with that said, let's move into enrollment and some of the enrollment process that you need to be aware of. So pre-enrollment materials. Prior to the enrollment of a beneficiary in this program, all brokers should provide the following information to the beneficiary: pre-enrollment letter, the enrollment form that they will need to fill out, a benefit summary so they know what plans they're enrolling in, and they should have access either in a hard copy, through the CBIA website, direct link, or online to both our formulary and our provider directory, both of which will be available on the CBIA website for you to access. And as I mentioned at the bottom of that slide, all materials will be available on the CBIA website at cbia.com/Medicare, which I'm sure most of you are familiar with. From the post-enrollment material perspective, once somebody enrolls in our program, they will receive an ID card, they will get an evidence of coverage, they will receive a benefit summary, they will also receive a provider directory if they do not opt out. What you're going to see on our enrollment form is a section towards the end of your application where they can opt out of receiving the provider directory. It's a very thick book. Once they've chosen the providers and we verify that the providers in the program, most people don't want us to mail out that big heavy book to them. So if they want to opt out, if they want to be green friendly, they can check off that they do not want to provide that to provide them the provider directory, and if they check that off on the application, we will not send them one. And they will also get a copy of our formulary as well. The enrollment process: the eligible applicant must complete the enrollment form. The applicant submits the application directly to the broker or to the employer. The broker or the employer, depending on your relationship and your situation with each of your groups, would submit that application directly to CBIA. The applications must be signed by the applicant no later than December 31st of 2012. Obviously, the sooner we get applications in, the sooner we'll be able to get people loaded into our systems and get them ID cards. The last thing we want to do is you're getting applications towards the end of December, submitting them to CBIA and then to ConnectiCare, and then have somebody at the pharmacy counter on the 2nd or 3rd of January trying to get prescription drug coverage, and our system hasn't been updated yet because it wasn't turned in until the end of the year. But they do have until midnight of December 31st to enroll. Again, I encourage you to get any applications into us sooner rather than later so we can get folks into the system and get their ID cards out to them. CBIA will then enter the information into their enrollment system. CBIA is going to send an electronic enrollment file to ConnectiCare. ConnectiCare will then submit these enrollments to CMS for approval. So communications during the enrollment process and after enrollment. Once we receive the application and once we submit it to CMS, ConnectiCare will send to the beneficiary an acknowledgement of receipt of the enrollment application, also known as our intent letter. We will then send a notice to confirm enrollment. So once CMS confirms for us that this individual is enrolled in our plan, we will send a notice to confirm the enrollment to the beneficiary. They will then receive a member ID card. The medical and prescription drug coverage is on the same card. At this point in time, in 2013, the individual, as I mentioned before, should put away the red, white, and blue card, keep it in a safe place, and whenever they receive medical services or they go to the pharmacy, they should present the Medicare VIP Medicare ID card. They will also receive a welcome kit. This is a separate mailing from the ID card. So they get the ID card, then they get a welcome kit in a separate mailing. It may arrive at the same time, but I just wanted you to be aware that they are separate mailings. They will also receive a welcome call from ConnectiCare. This is basically just a call. Mr. Smith, did you receive your ID card? Did you receive your welcome kit? Do you understand the program? Are there any questions that I can assist you with? So they will get a welcome call from ConnectiCare. There'll also be a health risk assessment call, which is basically done for individuals. It is a CMS requirement. We will call individuals to determine, based on health status, are there any programs that we may have that this individual may benefit from. Some of those programs that I talked about earlier through case management. They'll also potentially make an in-home health assessment call through a vendor called Inspires. This individual program targets certain individuals that may benefit from a nurse, case manager, or somebody going out to their home to do a full-fledged comprehensive exam to make sure we have captured all of the health conditions that this individual may have, to make sure that we're getting the appropriate coding from the providers that this individual is seeing, so that we can make sure we're maximizing the reimbursements that we get from the federal government to cover the services that this individual may need during the course of the year. In addition to this, I mentioned earlier, we will do outreach to members that may qualify for that extra help, that may qualify for that LIS subsidy, and that's done through a vendor that we use called Altegra. The reason I bring these up is I just want you to be aware of some phone calls that the beneficiary may get from us And if they do contact you directly, you'll know that they're legitimate calls and they're not part of our overall program. So I did want you to be familiar with those. Member services. Once a member enrolls in our program, these are the contact numbers. Again, all this information is provided on their ID card as well as other materials that they will receive from ConnectiCare. Member service representatives are available 7 days a week from 8 a.m. to 8 p.m. This is the number that individuals would call. Again, to try to simplify things, it's 1-800-CBIA. And anybody that needs special assistance may dial the hearing impaired line at 1-800-842-9710. And again, this information will be on ID cards as well as some other information that's given to the member. Some important reminders about our program. Why the ConnectiCare's VIP program? So you've heard me talk about the CBIA specific program. You've heard me talk a little bit about an overview of Medicare Part C plans and about the pharmacy Part D programs. So some of, again, the highlights of our particular program. It's a significant cost savings with a low $339.93 monthly premium compared to roughly around $580 to $600 supplement program that will also be available. Broker commissions on this plan is 3% of the premium. As I mentioned before, we are the highest ranked Medicare Advantage plan in Connecticut with 4.5 out of 5 stars. Excellent comprehensive medical and prescription drug coverage. Again, everything's done through one source. Everything's done through ConnectiCare here in the Farmington office. Beneficiaries or members will have the flexibility to use any Medicare-approved provider in the United States or its territories. We have worldwide coverage for emergency situations. We have that financial protection, that safety net, with a low $3,400. Again, as a reminder, that's coverage for individuals for any services that are provided under Medicare Part A and Part B that have any type of cost share under our program. They will track towards that out-of-pocket maximum. If the individual hits that out-of-pocket maximum of $3,400, those services would be covered at 100% for the remainder of the year. We also have vision discounts through participating providers of 25 to 30% on frames and lenses, and this includes contacts, sunglasses, prescription sunglasses, and we also have our quality disease and care management programs through our Touchpoints program. And again, those are all homegrown programs here for our offices in Farmington. So what are the next steps? On the CBIA website, which most of you are familiar with, will be the enrollment form. We have currently, I believe, an enrollment form that may be posted out there that we will be replacing within the next 24 hours. It's a CBIA-specific enrollment form, so we try to make the enrollment form as simple as possible for you. It'll be a CBIA-specific enrollment form that will be available on the website. The benefit summary will also be available on the website, which will give you more detail about each of the particular benefits and any of those benefits that have any limits or prior authorization on them. There'll be a link to the ConnectiCare website, which will give you access to our online provider search, as well as the provider directory, as well as the formulary. Claim reimbursement forms will also be available for those individuals who may seek care from a provider outside the state of Connecticut. But again, if they're a Medicare-approved provider, they can get services from that individual, and the benefits to the individual are the same either in or out of network. But there are certain claim forms that they may have to have filled out and submitted to ConnectiCare for both medical and pharmacy. There will be a mailing to all current CBIA Medicare supplement members from CBIA announcing this program, letting them know that it's available. There will also be a mailing directly from CBIA to all employer groups that participate in CBIA announcing this program and the availability of this program and this very attractive low-cost alternative. For any further information, questions that you might have, please contact your CBIA sales representative with any specific questions that you may have about the program. If there's something that we don't address during the question and answer session, or that we don't cover today that you have a question on, or if there's a question that you have after the presentation is concluded today, feel free to contact those individuals and they'll be able to assist you or to refer those questions on to ConnectiCare. In regards to our formulary, I also wanted you to be aware, as I mentioned before, for those of you who are familiar with our Medicare program, the formulary is different from commercial and the individual Medicare program. You're going to find, for those of you who are familiar with our individual Medicare program, our formulary is basically very similar to that in the sense that it is an open formulary. So if a drug is not listed in that particular formulary that will be provided to you, you can be assured that that drug, if it is a Medicare Part C drug, it will be covered under the plan at the Tier 3 level. So I just want to make sure that was clear as well. I want to thank you for joining us today. That concludes our presentation. At this point in time, I'd like to open it up to questions and answers, and we'll hang on the lines for as long as we need to answer any specific questions that you may have about our program. And again, thank you today, and we appreciate your support.
Well, thank you, Matt. And I know Tony and Teresa have been answering questions throughout the webinar on our Q&A block. If there are other questions, feel free to get them to us. I wanted to thank both Matt and Tony for the excellent job they did with their presentations. We actually got through this in a shorter time frame than we had anticipated. If you do have any questions in the future, as Matt said, make sure you get in touch with your CBIA sales team. Doesn't look like we have any more questions, so I wanted to thank you, the attendees, for joining us today. I hope you found the program to be informative and helpful. Again, get your questions to the CBIA sales team. And thank you very much, and have a great day. We got one question. Yeah, we did get a couple questions in here.
Yeah, there are some questions coming through. There actually just wanted to, for those that are still on, a couple of questions that did come through that I think might be worth noting for the rest of the group here, just to hammer home some of the points. The scope of appointment for those who are, play in the Medicare Advantage space, understand the requirement of capturing this document that CMS requires called the scope of appointment. Just to be clear, that is not required in the group space. So the question came up. I thought it was important to reiterate here. We also had a question regarding the donut hole and whether those how the copay structure works through the donut hole. To reiterate what Matt had gone over, we basically eliminated it for all intents and purposes, this concept of the donut hole, by having the copay structure in place that carries you right through the donut hole. So you go straight from beginning with no deductible all the way through to you hit the catastrophic coverage. Just want to make that point clear as well. And the third piece that came through that I wanted to clarify, which is different than what I think people are experiencing today in terms of the enrollment and the start dates and the contract versus calendar year concept. The way we've built this with CBIA, we're looking to have this all happen at a 1/1/2013 effective date. So a particular employer group might have a commercial renewal that starts off on April 1, July 1, what have you. We're looking to get those numbers in play for 1/1. So just wanted to sort of hammer that point home as well, so people really understood it, because it is a difference from what's out there today.
Great. Couple more questions, too, for Matt and Tony. If an employee goes from full-time to part-time status and they're not eligible for their employer plan, can they enroll in this if they're an over 20 group?
If they're no longer covered under the employer at that point, you mean?
Yes.
I think you're going to have to fall under the employer's coverage, and if you're no longer covered because you've gone part-time, I don't think you would qualify for this group coverage.
Yeah, this is Matt. You would need to meet the eligibility requirements not only of the Medicare that I talked about earlier, meaning having A&P, but also meet the eligibility requirements of what the employer defines as eligibility requirements. So if they're not part of the employer plan, they wouldn't be eligible to join this then, and they would need to look at perhaps one of their individual products instead.
Great. Looks like we've addressed all the questions, and if there are future questions, once again, contact your CBIA sales team. Got a lot of inquiries regarding whether or not the presentation will be mailed to you in the future. We are going to send out a link to the recording of this presentation for your review within the next day or so. So wanted to thank our presenters from ConnectiCare for participating, and also thank you to everybody who attended. Have a great day. Hey there.